Sleep divorce? Which is a terrible name, but it's actually a pretty reasonable strategy. If both are getting better rest, both people are showing up better in the relationship the next day. On today's round, we're talking about something that affects everything we've talked about on this show. Your hormones, your metabolic health, your recovery and your focus, your golf game, your marriage, all of it. We're talking about sleep. This is chapter 2 of the Back 9 Playbook. But honestly, this one is way bigger than golf. If you do nothing else right in midlife and you nail your sleep, you're setting yourself up for the kind of long, sharp, healthy life most people want. If your sleep falls short, almost nothing else works the way it should. So today, we're going to talk about why sleep matters so much in midlife, what's actually happening when you sleep, how to know if you're getting enough of the right kind of sleep, and what to do about it when something might be wrong enough that you need help. Welcome to Playing for Life, the podcast where golf, hormones, and midlife performance are finally in the same conversation. I'm Dr. Amy Garza, a midlife hormone expert, aspiring competitive golfer, and someone who believes better performance starts from the inside out. On this show, we connect what's happening in your body to how you show up on and off the course. It's about building a body that lets you live better, play better, and stay in the game longer. Because midlife is not where you stop playing, it's where you learn how to play for life. Let's tee it up. If you've listened to the Back 9 Fade episode, you'll remember that sleep was the pillar that tied everything else together. One bad night of sleep makes you more insulin resistant the next day. It throws off your cortisol pattern. It narrows your metabolic margin. We talked about it with the balance beam. Good sleep gives you a wider beam to walk on. Bad sleep narrows it dramatically. Today, we're going to go way deeper on that sleep piece itself. And a quick note, before we get into it, I'm a doctor, but I'm not your doctor. This episode is for education only. Use it to have a smarter conversation with your own doctor. Okay, let me start by making the case for why sleep matters. Because I think a lot of midlife adults have quietly come to accept poor sleep is just part of life. You're a parent, a professional, you're stressed, you wake up at 3 a.m. and can't get back to sleep. Maybe you've been doing this for years. Maybe you've just decided that you're just not a good sleeper. Maybe you've started taking something to help you sleep and it kind of sort of works. Sadly, a lot of my patients are now psychologically addicted to sleep medication because doctors often hand it out like candy the second someone starts to struggle. It's incredibly frustrating. I spend a lot of my time de-prescribing sleep medications for this exact reason. When it comes to sleep, I want you to consider a different frame. See, sleep is when your body does most of its actual repair work. Your brain literally clears out waste products during deep sleep. There's a system called the glymphatic system, and it's most active when you're sleeping deeply. It clears out things like beta amyloid. Maybe you've heard of that, the plaque that builds up in Alzheimer's. It's also when your muscles repair, your immune system resets, and your hormones reset. Testosterone rises during sleep and peaks around the time of your first REM episode. Growth hormone gets released, cortisol drops, insulin sensitivity improves. Your nervous system, it shifts out of that sympathetic, stressed, alert, go state and into that parasympathetic rest and recover state. When sleep is short or fragmented, none of that fully happens, and you feel it the next day. Your hormones, your blood sugar, your recovery, mood, even your decisions on the course. All of it is operating with less margin than it should. Not because there's something wrong with you, but because your body never got to do its overnight maintenance. So with that as the foundation, let me give you a quick overview of what actually happens when you sleep. Because once you understand the stages, those tracker numbers, and the strategies make a lot more sense. You see, sleep is not just one thing, it's cycles. You move through stages of non-REM sleep, light and lighter and deep, and then a stage called REM sleep. And then once you cycle through, you start the cycle all over again. And one full cycle takes about 90 to 120 minutes, and most adults move through 4 to 6 cycles a night. Deep sleep, which makes up roughly 15 to 20% of your night, is your physical repair window. This is when your body does that releasing of growth hormone, repairing tissue, consolidating your physical learning, and clears the brain waste I just mentioned. Deep sleep happens early, soon after you fall asleep, mostly in the first half of the night. REM sleep, which is also about 20 to 25% of your night, is your mental repair window. This is when you dream, when your brain processes emotions and memories, when you consolidate new learning, including new motor patterns. So if you've been working on a swing trains with your swing coach and you don't get enough REM sleep, you're not locking in what you practiced on the range. REM tends to happen more in the second half of the night. And light sleep, it's all the rest of it. It's not junk sleep, but it's not where the heavy repair is happening. Now you might be thinking, okay, how do I know what I'm getting when it comes to sleep? Well, that's where those trackers come in. A lot of you are wearing some kind of sleep tracker, an Oura Ring, a Whoop, an Apple Watch, a Garmin, maybe even on your mattress. Whatever you've got, here's what I tell my patients to actually look at and what to mostly just let go of. First, look at total sleep. That total sleep time is important. Are you getting between 7 and 9 hours? That's the range most healthy adults need. Some people generally do well on a bit less, but most of the people who think that are actually underslept and don't even know it. Look at the consistency of your sleep and your wake times. Are you going to bed and waking up around the same time most days? Inconsistency is one of the biggest hidden drivers of poor sleep quality. And it's the one thing most people are not paying attention to. Your circadian rhythm, the internal clock that runs your hormones and metabolism, even your cognition, it thrives on consistency. Look at your deep sleep and REM numbers as trends, not as single nights. And then inside the total sleep time, look at your deep sleep numbers and your REM numbers as important numbers that are trends. The single nights are less important. A bad night happens to all of us, so the pattern over weeks tells you the real story. If your sleep is consistently low on REM or consistently low on deep sleep, that's meaningful data. You also want to take a look at the HRV. This is heart rate variability. It's how much your heart rate varies beat to beat. It's normal to have variation, and more variation is actually better than less. We'll dig into the nuances of this in later episodes, but for now, just know that this is one of the best markers we have for recovery. Higher HRV generally means you're in a more recovered parasympathetic state. Lower HRV means the nervous system is under stress. So watch your trends. A sudden drop in HRV often means something is happening in your body before you can consciously feel it. What I want you mostly to ignore, or at least not obsess about, is that overall score your device gives you each morning, especially if you find yourself looking at it and feeling anxious or smug. Some of you have started letting the tracker tell you how you're going to feel that day instead of letting your body tell you. If your tracker's making you anxious, take it off for a while. The data is only useful when it informs you well. It's not useful if it starts controlling you. Now that you understand how to look at that tracker data, let's talk about what actually moves the needle on sleep. The sleep hygiene stuff. Most of this you've probably heard before. I'm going to tell you what I think actually matters the most and kind of roughly in order. Number one, the consistency. Same time to bed, same time to wake, as often as you can, including weekends. Your body wants you to be on a schedule, and the closer you can give it one, the better everything works. If you do nothing else from this section, do this. And number two is light. Specifically, get bright light, ideally sunlight, within 30 to 60 minutes of waking up. That signal anchors your circadian rhythm for the entire day. And then in the evening, do the opposite. Dim the lights, reduce your screens, get your house into evening mode. This is a simple thing that most people are not doing, and it can make a real difference. This can be as simple as switching from overhead lights to lamps at a minimum and dimming overhead lights if you can't do that. If you want to nerd out like I do, consider amber colored glasses when you can once the sun goes down. The darker orange a lens is on those blue blocking glasses, the more of that disruptive blue light that gets blocked out. So if you have those glasses that say blue light but are really clear lenses with a light, maybe yellow orange tint on them, they're not blocking near as much of that blue light as truly orange colored lenses will. All right. Number 3 is temperature. Your body needs to drop its core temperature to fall asleep and stay asleep. And a cooler bedroom supports that. Somewhere in the 65 to 68 degree range works for most people. If you're someone who runs hot or you're a woman in perimenopause dealing with night sweats, this becomes even more important. Cooling sheets, lighter pajamas, a fan, even temperature regulating mattress pads can be complete game changers. Number 4 is what you put in your body, the back half of the day. Caffeine has a half-life of approximately 3 to 6 hours, typically maybe 5, depending on the way your body processes caffeine. But what this means is the cup you drank at 2 p.m. still is floating around in your body around 8 o'clock at night when you're trying to wind down. Most people are way more sensitive to this than they realize. Try cutting yours back and see what happens. Get curious and just notice. And then there's alcohol. We talked about this in the last episode, but it bears repeating. Alcohol sedates you, but sedation is not sleep. You may fall asleep faster after a couple drinks, but the sleep you get is actually worse. Less REM sleep, more fragmentation, and you almost always wake up at some point in the middle of the night when the alcohol wears off or when your blood sugar tanks. Consistent waking at 2 a.m. may be a not so obvious blood sugar issue that started even before your head hit the pillow. Number 5 is a wind down routine. Your nervous system cannot go from full stop to deep rest in 60 seconds. Give yourself at least 30 minutes of low stimulation time before bed. Read an actual book. Stretch, talk with your spouse, pray, whatever works for you. The goal is to signal to your body that the day is over. I believe the day starts the night before, so I like to write out my food plan for the coming day, dump my brain of all unfinished tasks and to-dos, and review my calendar for tomorrow. This wind down habit can be a game changer. A clear mind sure makes it easier to sleep well. Now, midlife adds some specific complications to sleep, and I want to spend a few minutes on those because I see them every single day in my clinic. For women, the biggest one is hormones. As progesterone declines in perimenopause, and remember that can often start in your mid-30s, your sleep gets worse. Progesterone is naturally calming. It's almost like a sleep aid that your body naturally makes. When it starts dropping, your sleep drops off too. You start waking up at 3 a.m. and can't get back to sleep. You get night sweats, your sleep can become lighter and even more fragmented. This is a hormone problem, and it has a hormone solution. We talked about it in the progesterone episode. Replacing the natural progesterone that your body was making can be one of the single most effective interventions for sleep for women in their 40s and 50s, even younger for some. If you haven't listened to that episode, go back. It might change everything for you. And definitely consider before adding sleep medications if your progesterone could be causing your disruptions. And for men, midlife sleep gets disrupted by a few different things. Lower testosterone can be associated with worse sleep quality. At least this is what I see in my patients. A partner in perimenopause or menopause can keep you up when you least expect it. And prostate changes lead to more nighttime trips to the bathroom, which also fragments sleep. Even weight gain around the middle, which is a metabolic issue, shows up with sleep issues in midlife because it can increase your risk of sleep apnea. Which brings me to a really important point. If you snore loudly, if your partner's ever told you that you stop breathing or gasp in your sleep, if you wake up with a morning headache, you're exhausted during the day, regardless of how much sleep that you've got, you should seriously consider a sleep study. Sleep apnea is wildly common and wildly underdiagnosed. It's a major driver of cardiovascular disease, cognitive decline, daytime fatigue, depression, and yes, poor golf performance. We have great tools to treat it now, and home sleep studies are easy and very accessible. There's really no reason to live with undiagnosed sleep apnea, and yet so many people do. Same goes for chronic insomnia. If you've been struggling to fall asleep or stay asleep for more than a few months, that's worth getting evaluated. Most people don't realize this, but there's a treatment called CBTI, Cognitive Behavioral Therapy for Insomnia. It's actually more effective long-term than sleeping pills, and most people have never even heard of it. It's definitely worth asking your doctor about. Now, I want to talk about the partner piece because this is one of the most under-discussed sleep issues in midlife, and it can wreck both of you. Even if you don't fully realize it, your brain is being repeatedly pulled out of deep sleep by their breathing patterns. If your partner has restless legs, you're getting kicked. If your partner's in perimenopause and overheating, the room temperature could be playing a picture for you. If your partner wakes up at 5 a.m. and you don't need to be up until 7, their alarm is interrupting some of the most precious REM hours. And couples need to talk about this honestly. And here's the thing, sleep divorce, which is a terrible name, but it's actually a pretty reasonable strategy, has become more common and more accepted. Some couples sleep in separate beds, some sleep in separate rooms. It's not a relationship problem. This is a sleep strategy. If both are getting better rest, both people are showing up better in the relationship the next day. There's no rule that says you have to share a bed every single night to have a strong marriage. I have couples in my practice who've made this change and has been transformative for them. If sleeping separately is not on the table for you, and I get it, it's a real conversation for some couples, then at the very least, encourage your partner to get evaluated for sleep apnea if they snore. Encourage them to be treated. Their treatment will probably improve your sleep almost as much as it improves theirs. This is one of those rare situations where one person's medical care directly improves the other person's life. Okay, let me bring this back to golf for a minute because that's what the show is about. If you have a round that really matters to you, a tournament, a member guest, a trip you've been planning for months, the night before matters. But honestly, the more important night is the night before that one. 2 nights out is when you should be hitting your best sleep because of how sleep debt and recovery actually accumulate. So if you've got a big round on Saturday morning, the night to really protect is Thursday into Friday. Wind down early, no alcohol, cool room, set the conditions. But here's the bigger picture I want you to take from this episode. Your golf game is downstream of how you live. If you sleep well consistently, your hormones are better, your blood sugar is better, your decision making is sharper, your mood will be steadier, your recovery will be faster. And yes, all of that means your golf is better. If you sleep poorly, chronically, all of those things can suffer. You can't out-train, out-eat, or out-medicate poor sleep. You have to actually fix the sleep. So my ask for you this week is this. Take an honest look at your sleep. Not just hours, but quality. If you have a tracker, look at the trends, not just last night. If you don't, just notice. Do you wake up rested? Do you crash in the afternoon? Are you depending on caffeine to function? Are you depending on alcohol to wind down? Both of these are signs a sleep system is under strain. Just pick one thing this week, just one. Maybe it's your caffeine cutoff. Maybe it's a consistent bedtime. Perhaps it's getting morning sunlight, or maybe finally having the conversation with your partner about their snoring. Start small and watch what happens. Sleep is the single most powerful, most underrated and overlooked performance tool you have in midlife. You should definitely treat it that way. In the next episode, we're shifting gears completely. We're going to do something I've been wanting to do for a while. We're going to talk about what happens when one partner in a relationship gets TRT or testosterone replacement therapy and the other one doesn't. This is one of the most common painful patterns I see in my practice, and it shows up in marriages, in friendships, and yes, on the golf course. You don't want to miss it. If something in today's episode hit the sweet spot, do me a favor. Follow the show so you don't miss what's next, and share it with someone who's been quietly accepting bad sleep as just part of life. Drop a comment and tell me what your sleep struggle is, or what's the one thing you're going to try this week to shape your sleep. Until the next round, this is Playing for Life. Here's to living better and playing longer.